And Nigeria is continuing to record more deaths from cholera. Amaka Ode brings us an update on the situation.
Cholera is an acute diarrhea disease caused by the Vibrio cholerae bacteria. The bacteria causing cholera can be expelled through feces for nearly 2 weeks after infection. They can be shed into the environment to infect other people. It is passed on from feces through contaminated food, water, drinks, and unhygienic environment and causes severe dehydration. Infected people can die if their illness is not quickly managed with oral rehydration therapy. In the past, cholera infections were common in many countries around the globe. Now, they are mostly confined to developing countries because the disease is associated with poor nutrition, poor water quality, and poor sanitation. The proportion of people who die from reported cases of cholera remains higher in Africa than anywhere else. In Nigeria, huge outbreaks were recorded in 1991, 2010, 2014, 2018, and this year. In 2021 alone, an outbreak of the disease in Nigeria has affected 15 states and the Federal Capital Territory. The outbreak of cholera in Nigeria is usually heightened during the rainy season. According to the Nigerian Center for Disease Control, 6 states reported 1,786 suspected cases of cholera between June 20th and June 26th. Bauchi in 2021 alone has had 1,239 cases, Kano 362 cases, Niger 62 cases, Zamfara 55 cases, Kaduna 59, and Plateau State 9 cases. 325 deaths have occurred from cholera complications in 2021. The report from the Nigerian Center for Disease Control also indicates that 51% of the suspected cases are male, while 49% are female. The risk of death from cholera is higher when treatment is delayed. Lack of access to safe drinking water, poor personal and environmental hygiene are basic factors that promote the spread of cholera. Infection also occurs when people eat or drink something that's already contaminated by the bacteria. Nigerians have been advised to boil and store water in clean and safe containers before drinking, and also to wash hands frequently with soap under clean running water to prevent infectious diseases such as cholera. Amaka Ude, Arise News.
Right. Thank you very much, Amaka Ude there. We're now joined by Dr. Innocent UJAH, the president of the Nigerian Medical Association, who is in Benue State. Dr. Innocent, glad to have you join us.
Yeah, thank you so much for joining us on News Night. First off, help us understand why this upsurge in, or outbreak, if you like, in cholera again. 325 have died already so far, and from what we're gathering, 27% of suspected cases across the country fall between 5 and 14 years age bracket. What does that really tell us?
Well, thank you very much. First of all, it's very sad that in the 21st century, Nigeria keeps recording deaths from preventable conditions like cholera. I say so because as a DG of NIMA, in 2010, we were in Bauchi State. You can see the high level, the incidents in Bauchi State, were in Maiduguri, were in Gombe State because of the high incidence of cholera. Nigeria should not be experiencing this. Now, cholera is a disease of poverty, both financial poverty and poverty of knowledge. And the reality is that unless we have clean, good potable water, drinking water, the recurrence of cholera will continue. Let me put very quickly that even in cities, there is no city in Nigeria that runs a 24-hour pipe-borne water supply. And therefore, we are not doing well in the area of water supply. And even when we have, we find that many of them are contaminated, just like it was reported. It is also true that personal environmental hygiene are big problems. Drinking water is dirty, and we could easily get good water supply because, drinking water, if we boil our water, properly. It will kill the germs. Unfortunately, we do not take that time to boil our water. The ideal thing is to have water, pipe-borne running water in all parts of the country. We have what we call water environmental hygiene and sanitation and hygiene. Unfortunately, I think that we are not up and about in this regard. What we need most is general and health education. We need to educate our community. We need to educate our people. The National Orientation Agency should come over the place to translate these messages. If it becomes necessary, if anybody is infected, you should go to the hospital on time. Like it was reported, drinking water, dehydration is very, very important. Enormous dehydration, but oral dehydration therapy will not be able to solve the profuse vomiting and diarrhea that are associated with cholera. And therefore, patients should get to the hospital on time so that they can have a fluid replacement through intravenous fluid replacement. In that case, you find that many of our people who probably will come down with cholera would be saved. There's no reason why 325 Nigerians will die of cholera. It is a reflection of poverty. It's a reflection of underdevelopment. And we need to do more than what we are doing.
You talked about financial poverty and poverty of knowledge.
Yes.
One would like you to really break this down for clearer understanding. When you said, there are big diseases that people suffer, but you said this is a disease of poverty, financial and poverty knowledge.
Yes, I say so because you see, the financial poverty will be a situation where a patient who would ordinarily want to go to the hospital for treatment will not go because he doesn't have financial backing or she does not have some money to go to the hospital. Poverty of knowledge is a situation where you may even have money, but you don't know what the appropriate means to get yourself treated. That is poverty of knowledge. Once we talk about cholera, they may tell you that it's somebody causing somebody. It is either if in polygamous family, maybe it's one wife that is trying to bewitch the other one. Those are poverty of knowledge. And we need to know that we want to wash our hands, just like we talk about COVID. We need to wash our hands. We need to ensure that we use soap to wash our hands. If you can see open defecation is all over the place. And that is clearly both financial poverty and poverty of knowledge. Open defecation, now it's rainy season, all physicists that are defecated all over the place will now find a way to the water.
Absolutely. And 47, if I may come in very, very quickly, we don't have much time. 47 million Nigerians actually practice open defecation. Apparently, there's an oral cholera vaccination campaign ongoing. Tell us more about that. And what kind of response would you like to see from the federal government and, of course, governments at different levels? Very quickly, if you can do that in a minute.
Well, the truth of the matter is that, yes, there are vaccines to immunize, but I think the best thing is to prevent by basic water, clean water supply by federal and state governments, and even the digging of wells by local governments if they cannot afford boreholes. The federal government alone cannot do it. We need state governments to also support. And then, of course, the private sector. We need water everywhere. Water is life, and we should not joke with it. Why should anybody die because he or she doesn't have water or good water supply?
Thank you. Thank you very much, Dr. Innocent UJAH, NMA President.